the either of these targets. So we are nowhere near vaccine inequity, and the problem actually is that as long as there is vaccine inequity, as long as there are vulnerable people who are not protected, we leave room for the virus to multiply, we leave room for surges of outbreaks, whether they are driven by new variants or not, and this then results in further mutations. So that is why WHO is urging for a moratorium on booster doses unless they are absolutely indicated in the case of immunocompromised individuals, so that more equity can be achieved globally through vaccination. Thank you.
Would you say, Dr. Rabi, the WHO Director General said that this decision is to help low-income countries to vaccinate at least 40% of their population. Now that the Philippines have only vaccinated around 15%. Now, do you think that the 40% by year end is attainable?
We continue to work with the Philippines government, as with many other governments, to ensure that those 40% targets are achieved. I might remind you that WHO through COVAX initiative agreed to provide enough vaccines to protect 20% of the population, the most vulnerable populations, by the end of this year. We have already provided 13 million doses. Those 13 million doses, 3 million doses were single-dose J&J vaccines, and 10 million were double-dose vaccines. So those vaccines have been able to fully protect 8 million people already. We are looking at increasing vaccine allocations for the Philippines. Actually, we have some good news this morning. COVAX has allocated a further 10 million doses to come to the Philippines within the next few weeks. So we continue to, and this was what we expected. We expect much larger consignments to come within this third and fourth quarters to the Philippines and to many other countries who are recipients of COVAX vaccines. And so we will be mobilizing larger and larger quantities of vaccines so that we achieve that 20% population protection before the end of the year. Thank you.
What is the reaction of the vaccine producing countries to this moratorium? Will they comply?
Well, it's a complex issue because, as we said, we are looking very carefully at the evidence, and the evidence right now shows that the available vaccines are effective in protecting from severe disease and death. We also note that the evidence is that the currently available vaccines, when people are fully protected with them, protect against the circulating new variants. So really there is no justification at this point of time for a booster dose unless it is for immunocompromised individuals. And this is also a space that we are looking at because it's pretty complex. If we are talking of a third dose of which vaccine? Is it the same vaccine? Can we look at combinations of vaccines? We simply don't have the safety information. So it's about the efficacy information and the safety information, and that's why we are saying we are working to gather better evidence so that we can decide and recommend on policy issues. In the interim, we see that the biggest benefit will be by addressing inequities and providing vaccination coverage to as many people, especially the vulnerables, as quickly as possible.
Dr. Rabi, how about the people for the people coming from the vulnerable sector? Will there be a compromise as to when and how they can receive their booster shots?
There is no, right, like I explained, Secretary Martin, there is no need at this point of time for booster shots for people coming even from the vulnerable groups. The only group that may require a booster are those immunocompromised individuals. So we are looking very closely at the evolving evidence, and we don't have a recommendation as yet that vulnerable people require a booster unless they are immunocompromised. When we have better evidence, we will be in a position to recommend such a recommendation, provide such a recommendation. In the interim, we continue to say that the best use of vaccines will be to vaccinate the unvaccinated vulnerable people. Thank you.
With cases tallying from 20,000 to 26,000 a day, can you say that the Philippines is the new epicenter of COVID-19 in Southeast Asia? And do you think that our healthcare system can still bear the surge that we are experiencing right now?
We have noticed that with the predominance of the Delta variant globally, many countries, particularly in this part of the world now, are experiencing surges. Several countries in our region are reporting in or around 20,000 or excess cases, and this is not unique to the Philippines. This was expected. In fact, that's why we were working before the Delta variant came, looking at the experience of other countries affected by the Delta variant to push for vaccination of the most vulnerable elderly groups so that we could prevent them falling sick, developing severe disease, and causing a surge in the healthcare facilities. We have made progress, but unfortunately the progress in the Philippines has been painfully slow. We still have nearly 3.6 million elderly people who have not received a single shot. This is unfortunate, it is unsatisfactory, it's also a reflection of the inequity that we are seeing globally happening within country, which we need to correct urgently. So as COVAX delivers more and more vaccines, we urge for protecting the most vulnerable as quickly as possible, and that includes the elderly, because we see that 7 out of 10 deaths in the Philippines are reported in this group of above 60. So if we really we want to protect lives, and if we want to protect lives, we need to use the vaccines that are coming to protect these people. So yes, we are seeing increase in transmission. We are actually seeing more than double the number of active cases that we saw during the surge in April. But so far, the healthcare system has been holding up, and that's largely because we are seeing fewer cases among the vaccinated, particularly here in NCR, where you have about 80% of your elderly fully vaccinated. So this is good. But there are areas in the country where the elderly vaccination coverage is just over 24%. This is unsatisfactory. We need to correct this as quickly as possible, because we are seeing a surge affecting many other regions, and many regions in the Philippines, the elderly coverage is still below 40%. So we need to do better, and we urge the local chief executives and the local health authorities to prioritize, to create avenues so that these most elderly people can be vaccinated and their lives protected. At the same time, we also need to make sure that with this unprecedented number of cases, we do everything possible to reduce and control transmission, and that includes our non-pharmaceutical interventions, our quarantine levels, how we manage that. We need to be very careful that in our messaging we don't send the wrong signals to the population. we need to ensure that the movement restrictions that have allowed us to hold at this level are maintained till we see a decrease in the transmission trend, because if any changes in the policies result in a further increase in transmission, this could result in an overwhelming of the already stretched healthcare facilities. So let us be very careful in addressing this evolving situation. It's about vaccinating the most vulnerable people, but it's also about ensuring full compliance with the minimum public health standards. This is the way we can break the chains of transmission and reduce the transmission and protect more lives. It's important. WHO has from the beginning stated that we want our two priorities in this response to the pandemic is protecting lives and protecting the economy and allowing for economic revival. But to do that, first and foremost, we need to ensure that our hospital systems are not overwhelmed, our healthcare workers are not overwhelmed. The way to do that is to prioritize vaccination of the most vulnerable, elderly and comorbid populations across the country. We should not create inequity within the country when we are vaccinating our people. Thank you.
Is the number of vaccinated population of Metro Manila already enough to drop the stricter restrictions previously implemented by the IATF?
We have significant population coverage within NCR. I believe it's about 60% now. But this is not adequate at this point to relax our quarantine positions. Now, you may recraft the terminology, but basically what we are advising is make sure that those restrictions are followed, that we don't relax too much, because we are not in a position where we can relax and experience a further worsening of this transmission level, because our health systems are just holding up. If there is a further increase in the current transmission levels, it could lead to an overwhelming of the hospital systems. That's why we need to be very careful in calibrating how we respond to the current situation.
We have some media questions. I'll turn you over to Yusek Rocky Ignacio.
Thank you.
Good morning, Dr. Rabi from Caroline Bongkin of CNN Philippines. Will the WHO consider giving a special consideration or exemption on giving booster shots to health workers?
Yusek Rocky, I just explained that we don't see a need at this point of time for universal booster doses for all healthcare workers. Among healthcare workers also there could be immunocompromised individuals, and there may be a need for those individuals to receive a booster shot. But universal administration of booster shots for even healthcare workers at this point of time, WHO does not have a recommendation to support that.
Dr. Rabi, this question is from Red Mendoza of Manila Times. Critics of the Philippine government response for COVID-19 say that the country cannot do its experiment anymore on granular lockdowns and instead focus on harder lockdowns and giving financial aid, which the government is not anymore capable of. What does the WHO say about these criticisms of the response?
Yusek Rocky, it's a good question. I'm not addressing the criticisms per se. What I'm saying is that in the light of the current levels of transmission, we need to maintain the levels of restriction that have helped us to hold the current levels of transmission and not create a situation where it could increase. Now, how those levels of restrictions are implemented whether they are called quarantine classifications, whether they are called granular lockdowns, does not fundamentally matter. The issue is that the people and other stakeholders need to realize that there is continuing transmission, that there is an important element that we need to reduce movement, we need to ensure compliance with the restrictions, because if we relax further, it is likely that with such a transmissible variant here, we will see more cases. So what it is called is immaterial as long as we message clearly to the public that we need to follow the restrictions so that we reduce the transmission. This is what is most important at this point of time. Thank you.
Dr. Rabi, his next question still, Red Mendoza of Manila Times, a columnist of our paper, said that the WHO has been pandering to the DOH because of your continued support to the wearing of face shields, and should speak more frankly on the faults of the government's COVID-19 response. What can you say about this?
Our position on face shields has been articulated quite clearly several times, so I don't need to reply to this question again.
Dr. Rabi, what is your parting message to the public?
Our parting message is that we are in a very critical situation. We need to do everything possible. We need to ensure that our most vulnerable have access to vaccines and are vaccinated fully. We need to ensure that everybody does everything possible to follow the minimum public health standards and ensure that there is less room for transmission. And that is everybody's responsibility. Every individual needs to do the maintaining of the physical distancing, the hand hygiene, the wearing of masks, so that we can ensure that there is no continuing transmission of the virus and we can break the chains of transmission. If we are having signs and symptoms, we need to quarantine, isolate, get ourselves tested. We need to improve our testing regimes. We need to improve our contact tracing mechanisms. We need to further expand our healthcare system so that we can manage the increasing number of patients who require the support when they develop severe disease. And we need to communicate quite clearly that the risk is not past. We still have a long way to go in this battle, and we need to continue to work together in unison to ensure that we can reduce the transmission and come out of this situation. Thank you.
To the Philippines, Dr. Handa.Ph Singh. Stay safe, sir.
Thank you so much, Secretary Handa.
Yan po muna ang ating pagsasaluhan ngayong Martes. See you all tomorrow. Yusek Rafi.
Thank you, Secretary Martin. Samantala, sa iba pa nating balita, binuksan na po ang ika-139 na malasakit center sa bansa na matatagpuan po sa COVID Referral Hospital na Quirino Memorial Medical Center. Ang naturang malasakit center ang pang-10 sa lungsod ng Quezon. Narito ang report.
Isa ang Quirino Memorial Medical Center sa Quezon City sa mga COVID Referral Hospital sa Metro Manila. Pero takbuhan rin ito ng mga pasyenteng walang kinalaman sa COVID-19 ang sakit.
Dahil ang Quirino Memorial Medical Center ay walang tinatanggihan mga pasyente, no? COVID man o hindi COVID, lahat po yan pinaglilingkuran namin.
May mga pasyente rin anya na hindi kayang bayaran ng hospital bills, lalo na ang mga mahihirap.
Ang magsisilbing tagapagpadaloy ng programa ngayong hapon.
Pero hindi na magiging problema ngayon ang hospital bill ng mga mahihirap na pasyenteng ang takbuhan ay ang Quirino Memorial Medical Center dahil nagbukas na ang malasakit center dito.
Wala na po ako nakikitang dahilan na hindi natin matulungan at masuportahan yung mga mahihirap nating mga pasyente. Pakahirap po na maging mahirap, lalo-lalo na po sa panahon ngayon, wala po silang matakbuhan. Ayoko po mangyari na naghihingalo po ang ating mga kababayan na wala silang matakbuhan.
Sa tulong po ng lahat ng mga departamento at ahensyang nakadikit sa Malasakit Center, hindi na po sila mag-atubili na pumunta sa kahit anumang government hospital katulad ng aming institusyon na Quirino Memorial Medical Center.
Target ng Malasakit Center Act of 2019 na malagyan ng Malasakit Center ang lahat ng ospital na pinatatakbo ng DOH at maging mga public hospital na pasok sa kriteria na itinatakda ng batas.
The more na Malasakit Center na pwede natin buksan, mas mabuti po. At pakiusap ko lang naman sa susunod na administrasyon, kung sino man po ang papalarin, ay sana po ipagpatuloy ninyo yung mga programang magaganda na nakakatulong naman po sa mga kababayan natin.
Ito na ang pang-10 Malasakit Center sa Quezon City at pang-139 sa buong bansa. Pinasalamatan rin ni Senador Christopher Bongo ang mga medical frontliners ng ospital sa laban kontra COVID-19. Matapos ang programa, ang outreach team ng senador ay namahagi ng mga grocery pack, pagkain, mask, face shield at vitamins sa 359 na mga pasyente at halos 2,000 medical frontliners. May ilan pang bike, computer tablets at sapatos na pinamigay ang tanggapan ni Go. Ang DSWD naman ay mayroong pinansyal na tulong sa 359 na mga pasyente at sa mahigit 800 rank and file employees ng ospital.
Samantala, alamin naman po natin ang updates ng COVID-19 sa bansa. As of 4 p.m. kahapon, pumalo na sa 2,248,071 ang kabuang kaso ng COVID-19 sa Pilipinas, kung saan 20,704 sa mga ito ay bagong naitala. Nasa 180,293 na individual naman po mula sa kabuang bilang ang patuloy na ginagamot o nasa mandatory quarantine. 22,290 din ang nadagdag sa mga gumaling kahapon, kaya umabot na sa 2,032,471 ang total recoveries. Sa kabilang banda, 163 naman po ang nadagdag sa mga nasawi. Ang total deaths sa ngayon po ay 35,307. Patuloy po ang aming paalala na sumunod tayo sa ipinatutupad na standard health protocols. Ugaliin natin magsuot ng face mask at face shield kung tayo ay lalabas ng bahay. Ngunit kung hindi naman na kailangan, ay stay at home muna tayo. Iba yung pag-iingat po ang ating gawin laban sa COVID-19. Puntahan naman po natin ang balitang nakalap ng ating kasamahan sa Philippine Broadcasting Service mula sa iba't ibang lalawigan sa bansa. Ihahatid yan ni Ria Arevalo mula sa PBS Radyo Pilipinas.
Maraming salamat, Yusek Rocky, para po sa ating mga balita. Lambak, Cagayan, pumangalawa sa Metro Manila na may mataas na kaso ng Delta variant. Mula Tuguegarao, narito ang report ni Florence Tarsina.
COVID Radio. Hashtag Laging Handa. Radyo Pilipinas Special Coverage.
Pumangalawa ang Rehiyon 2 sa may pinakamaraming naidagdag na kaso ng Delta variant ng COVID-19 sa buong bansa. Batay sa datos ng Department of Health, sinundan ng rehiyon ng Metro Manila matapos makapagtala ng 52 local cases at isang returning overseas Filipino. Karamihan sa mga naidagdag na kaso ay mula sa Isabela na may 23. Pinakamarami rito ang lungsod ng Santiago na may 10, tig-3 San Agustin at San Mateo, habang tig-1 sa Jones, Quezon, Ramon, San Isidro, San Manuel at Santo Tomas. Pawang local cases sa mga ito maliban sa isang ROF na ang permanent address ay sa bayan ng Etchage. Nakapagtala naman ng 12 kaso ang Cagayan, kung saan 4 sa Baggao, tig-3 sa Alcala at Igig at tig-1 sa Tuguegarao City at Apari. Ang Nueva Vizcaya ay may 10 kaso na mula sa Bayombong na may 4, 2 sa Aritao at tig-1 sa Bagabag, Bambang, Dupax del Norte at Kasibu. Ang Quirino ay may naitalang 8 kaso mula sa Difun na may 3, tig-2 sa Madela, Taglipay at 1 sa Cabarugis. Karamihan sa mga ito ay fully recovered na maliban sa kaso ng San Isidro at ng isang kaso sa San Mateo, kapwa mula sa Isabela at taitalang pumanaw mula sa sakit. Patuloy ngayon ang masusing case finding at contact tracing na sinasagawa ng Special Action Team ng Regional Epidemiology and Surveillance Unit para matukoy ang iba pang nakasalamuhan ng mga nagpositibo. Sa ngayon ay nakapagtala na ng 124 cases ng Delta variant ang buong Lambak, Cagayan. Mula sa DWPE Tugigaraw, Florence Tarsina, Radyo Pilipinas.
Samantala, 26.76% sa 5.6 million na target eligible population sa Western Visayas ang nakatanggap na ng COVID-19 vaccines. Mula Iloilo, narito ang detalye kay Bing Pabiona.
COVID Radio. Hashtag Laging Handa. Radyo Pilipinas Special Coverage.
Unti-unting tumataas ang numero ng nakatanggap ng COVID-19 vaccine sa kanlurang Visayas. Sa record ng Department of Health 6 as of September 13, 2021, nasa 26.76% o 1.5 million sa 5.6 million na target eligible population ang nabakunahan ng first dose, habang ang fully vaccinated ay nasa 17.40% o mahigit 970,000. Ang Iloilo City ang may pinakamataas na accomplishment na umaabot sa 89.12% o mahigit 343,000 ang nakatanggap ng unang dose sa mahigit 335,000 na target. Sumunod ang Bacolod City na may 44.42% ang naka-first dose sa target na mahigit 410,000. Ang probinsya ng Aklan may 28.05% ang naka-first dose sa 428,000 na target. Probinsya ng Iloilo, 23.65% o mahigit 343,000 ang nakatanggap ng unang dose sa 1.5 million na target. Antique, 22.90% ang naka-first dose sa 433,000 na target. Guimaras, 22.10% ang naka-first dose sa 131,000 na target. Capiz, 22.01% ang nabakunahan sa mahigit 568,000 na target. Ang Negros Occidental ang may pinakamababa na may 16.24% ang nabakunahan sa mahigit 1.8 million na target. Mula sa Iloilo, Bing Pabiona, Radio Pilipinas.
At yan po mga balitang nakalap ng Philippine Broadcasting Service. Mula dito sa Radyo Pilipinas, ako po si Ria Arevalo. Balik po tayo kay Yusek Rocky.
Maraming salamat sa iyo, Ria Arevalo. Inilabas na po ng IATF kagabi ang inaabangang para sa pilot implementation ng Alert Level System for COVID-19 Response sa National Capital Region. Dito magpo-focus po ang pamahalaan sa granular lockdowns na kadepende ng tao at mga magbubukas na establishmento sa Alert Level System ng DOH. Para ipaliwanag yan ng husto, narito po si Yusek Maria Rosario Vergere, ang tagapagsalita po ng Department of Health.
Good morning, everyone. Today I will be presenting a briefer on the alert level system that will be used in the pilot implementation of the proposed community quarantine policy shift in the National Capital Region. First, let me provide a brief situationer. Confirmed cases show a steep increase and has exceeded the 7-day moving average. Our epidemic curve shows that the latest peak at the 4th week of August has surpassed the peak seen last April of 2021. Cases from September 6 to 12 recorded 20,959 cases per day, an increase of 2,675 or 15% cases per day compared to the previous week of 18,284 cases. The National Capital Region contributed 28%, Region 4A 22%, and Region 3 at 11% to new cases in September. Nationally, we remain to be at high-risk case classification with a positive 2-week growth rate at 27% and a high-risk average daily attack rate which increased to 17.81 cases for every 100,000 individuals. 12 regions were also classified as high-risk. A lower positive 2-week growth rate was seen nationally and in 8 regions: National Capital Region, Region 4A, CAR, Regions 2, 3, 10, Caraga, and Region 12. The total bed and ICU utilization rate at high risk nationally and for 7 regions, which are CAR, Region 4A, Region 2, 3, 11, 10, and Caraga. The NCR maintains a positive 2-week growth rate and a high-risk average daily attack rate and is currently at high-risk case classification. The ADAR increased from 29.69 in the previous week to 39 per 100,000 population in the recent week. Total bed utilization was at upper limit of moderate risk and ICU utilization is at high risk. We would also like to show the analysis we did for our mortality, healthcare utilization, and detect to isolate data. We looked at case fatality per region and we saw that nationally, the case fatality rate was lower this year at 1.49% versus that from last year at 2.47%. The National Capital Region had the highest cases and deaths in 2021, but its case fatality rate was the lowest among all of the regions at 0.94%. It also had the highest full vaccination coverage at almost 60%. We computed the case fatality rate per month or the proportion of deaths among cases who were positive for this month. We noted that the highest case fatality rate was in March to April of 2020 at 10 to 19%. This decreased to around 2% by August of 2020 and further decreased to less than 2% by February of 2021. August of 2021 had the lowest monthly case fatality rate at 1.04%, but this should be interpreted with caution since there are delays in reporting of deaths. Comparing August 20 to September 2021, the number of total COVID-19 beds increased from 13,000 to 40,000, that is 210% higher, and ICU beds from 1,247 to 4,209 or 223% higher. While utilization rates were highest this August to September of 2021, had we not increased our beds, utilization rates for August to September could have reached critical risk, given that our ADAR and ICU admissions increased to almost twice compared to April of 2021. Case detection to isolation time seemed to improve from last year. However, there was no significant improvement in this interval, which was seen across 2021. Since March of 2021, detection to isolation have remained within 6 to 7 days. In the National Capital Region, the trend mirrors that of the national level. However, unlike the national healthcare utilization rates, the ICU utilization were lower for August and September of 2021 versus April of 2021, despite a higher ADAR and a twofold increase in the ICU admissions as total beds increased to 10,401 and ICU beds to 1,044 beds. Detection to isolation interval in the region also improved in 2021, with only little improvement through the months as interval remains within 6 to 8 days since December of 2020. Let us now look at our healthcare worker data. Case fatality rate is lower in healthcare workers than the general population and has remained below 1% since April of 2020. Looking at the national trends, while the peak in cases in March to April 2021 saw an accompanying increase in the number of cases and deaths among our healthcare workers, the number of healthcare workers cases and deaths were lower in April of 2021 and August of 2021 versus July to August of 2020. The reduction in healthcare worker cases and deaths were more apparent in the National Capital Region, with only 5 deaths reported in 2021. No death has been reported since June of 2021 for the National Capital Region. Note that the vaccine coverage for healthcare workers is 96% nationally and 94.7% in the National Capital Region. While we can see that there are more healthcare worker infections and cases in the past weeks, their case fatality rate remains to be low, most likely due to the high vaccination coverage and the protection of vaccines against severe disease and deaths. Our next analysis is among our elderly population. The case fatality rate among our older population was highest in March of 2020 at 31.4% nationally and 30.38% for the National Capital Region. It started to decrease to less than 10% since February this year. Even during the peak in cases last April of 2021, the monthly case fatality rate was only at 6.82%. Cases and deaths among senior citizens increased in 2021 versus 2020, both in the national and in the NCR data. But looking at the August 2020 peak, we had 8,838 elderly cases and 940 deaths. Comparing this to the April of 2021 peak, where elderly cases reached 18,231 with 971 deaths, which is only slightly higher than the deaths in August of 2020. Note that the vaccination coverage for elderlies is 50% nationally and 81.49% for the National Capital Region. Now let us look at the rationale for this policy shift and the use of our alert level system. This shift in our community quarantine policy was deemed necessary due to the following reasons. First, as we can see in the graph shown, we were more mobile during the latest ECQ last month than during the ECQ in April of 2021, as more essential activities and workers were allowed. Second, it was found that 80% of our new cases only came from a small proportion of our barangays doing the spatio-temporal analysis. This supports the move to focus on locking down selected granular areas rather than the entire province or highly urbanized city or independent component city, which heavily impacts our economy. And lastly, disease model projections show that lower cases can be achieved when we improve on our minimum public health standards, case detection to isolation time, and vaccine coverage even at lower community quarantine classifications. This highlights the importance of active case finding, intensive contact tracing and testing, early isolation of infected individuals, and enforcement of minimum public health standards, plus vaccinations. So now we go to our alert level system. First, let us answer the question of what is an alert level. Alert levels were designed to be a guide on what needs to be done given the current COVID-19 situation in an area. Each alert level is accompanied by a set of interventions to focus on across the different component strategies of the national COVID-19 response. Given this, it is an action-focused approach to classifying areas. An alert level is not equal to the community quarantine classification. The current community classification framework focuses on healthcare utilization to escalate, whereas alert levels look into both case data and the COVID-19 beds utilization to classify areas. Furthermore, this alert level classification can be a basis for establishing a feedback loop to ensure that actions are done to address any worsening in the COVID-19 situation in the area. Unlike the previous framework for community quarantine classifications, where escalations are solely based from the healthcare utilization rate, the alert level consider both case classification and utilization rates. And this is a more encompassing view of the COVID-19 situation in an area. Using these metrics, we can delineate increases in utilization that is driven by increase in cases and will be the basis for classification to higher alert levels. This is a visual presentation of the alert level system. In this framework, it is shown that alert level classifications consider both case transmission and bed utilization in its classification of areas under alert levels 1 to 5. Using this criteria, the National Capital Region will be under Alert Level 4, given the following metrics. In terms of case classification, the National Capital Region is at high risk given a moderate risk 2-week growth rate at 28% and a high risk average daily attack rate at 39 per 100,000 cases or population. On its health capacity, total bed utilization of NCR is at moderate risk at 69.58%. However, ICU utilization is currently at 77.58%. We shall be regularly assessing the situation in the National Capital Region to monitor the changes in cases and utilization data, as well as the implementation of the recommended strategies and activities aimed at reduction of case transmission and hospital utilization during this Uulitin ko rin talaga. Sige. Using this criteria, the National Capital Region will be under level. Using this criteria, the National Capital Region will be under Alert Level 4 given the following metrics. In terms of case classification, the NCR is at high risk given a moderate risk 2-week grief. In terms of case classification, the NCR is at high risk given a moderate risk 2-week growth rate at 28% and a high-risk average daily attack rate of 39 per 100,000 population. On its health capacity, the total bed utilization of NCR is at moderate risk at 69.58%. However, ICU utilization is currently at 77.58%. We shall be regularly assessing the situation in the National Capital Region to monitor changes in cases and utilization data, as well as the implementation of the recommended strategies and activities aimed at reduction of case transmission and hospital utilization during this policy shift pilot implementation. In this slide, we summarize the action points per alert level. Here, we focused on 8 response components, and we tried to indicate here the difference in approach for each component per alert level. However, it must be noted that while there are certain differences, some of the interventions remain constant in each intervention. In particular, we note the components that more or less stay the same per alert level, while others have more specific instructions per alert level. First is case detection. This is crucial in all levels. We simply emphasize that in areas with increasing cases and bed utilization, this must be further intensified to ensure that cases are found and managed. Whole genome sequencing. Alert levels 1 and 2 would focus on securing samples for representatives in the area. In alert levels 3 to 5, samples will be taken from priority areas, meaning areas with unusual spikes and identified clusters. This is to see if a known or new vaccine of concern is driving the increase in the number of cases. Third is risk-based testing using RT-PCR. It shall be implemented across all alert levels. However, we may use antigen test in alert level 3 and up to facilitate faster detection of cases among the symptomatics and the close contacts. Fourth is contact tracing. It should prioritize location, assessment, and the quarantining of close contacts. Next is isolation, which is to be done regardless of alert levels. Facility isolation is still encouraged. The next would be on triage and referral up to treatment. The presence of a good triage and referral system and adequate beds and healthcare human resources lowers our healthcare facility utilization rate and ensures that severe and critical cases which require admission are prioritized. In the higher alert levels, focus will be on addressing increasing healthcare and critical care capacity to accommodate increasing admissions. And lastly, vaccination. It shall be fast-tracked with our A1, A2, and A3 populations at most priority as they have the highest risks for severe disease and fatality. For areas in alert levels 3 to 5, vaccine deployment will be reprioritized to areas with increase in the number of cases. For alert 5, approach is almost similar to alert level 4, but guidelines applicable to ECQ shall be observed. Overall, as the alert level increases, there will be an increasing focus and intensity in the interventions to be implemented. the alert levels 1, 2, 3, 4, and 5 would not be the same as the previous community quarantine restrictions since it also considers the 3 C's framework: closed, crowded, and close contact in allowing certain activities. The country is moving towards more targeted and recalibrated actions towards high-risk activities, imposing these localized or granular lockdowns at the household and barangay levels, and implementing targeted response strategies to prevent transmission and eventually reduce economic strain. Alongside the shift in this policy, we must continue to religiously and correctly adhere to the minimum public health standards and ramp up our vaccination and prioritize the most vulnerable and high-risk population groups. Maraming salamat po.
Thank you, Yusek Barrere. At para po sagutin ang ilan natin tungkol sa bagong granular lockdown system, makakausap po natin muli si DII Undersecretary Pemaco Densing III. Good morning po, Yusek.
Magandang umaga, Yusek Rocky. At sa lahat ng ating mga media partners, magandang umaga rin po.
Opo. Yusek, mula kay sa Medinilla ng Mirror, magkakaroon po kaya daw ng rule for traveling between cities during the pilot of the alert level system in NCR, which will be under level 4. Paano po kaya ma-avoid fusion sa mga taong dadaan sa different cities during the said period?
Sa alert level 4 po, intra and interzonal travels are really allowed. Wala ho na yung distinction kung babiyahe tayo from one city to another dito sa Calacang, Maynila, at wala rin problema kung lalabas po tayo ng Calacang, Maynila. May pagkakaluwag po yung ating pagbabiyahe at ang restriction ay manggagaling na lamang po dun sa lokalidad ng ating pupuntahan.
Opo. Sunod po niyang tanong, Yusuf, po kukunin at magkano po ang budget na i-allocate po ng national government to help LGUs in implementing granular lockdowns under the alert system?
Wala ko kung mababanggit na amount, no? Pero ang usapan at pagkasunduan po, kalahati ng requirement ng food packs ng isang area na i-granular lockdown ay sasagutin po ng pambansang gobyerno, at kasama na rin po yung mga pangangailangan doon kagaya po ng medisina at mga PPEs para masigurado na hindi rin po mahawaan yung mga taong mag-implement ng granular lockdown.
Opo. Ang last question po ni sa Medinilla, in areas currently under granular lockdowns in NCR, and is this expected to increase once na ma-implement po ang system?
Well, base sa ating statistika ngayon, tumataas na po yung mga numero ng areas na gina-granular lockdown dahil banggit ko nga, bago pa man dito mga alert system na ating ipatutupad, pinagpapatupad na po tayo ng granular lockdowns.
Opo. Ba daw na posibleng walang magiging prior warning sa mga lugak ang COVID-19 cases na isa sa ilalim po sa lockdown, gaya po ng sinabi ng ILG at Malaya, maging sanhi pa yan ng friction sa mga resident implementing agency.
Well, hindi naman po siya hard rule, ano? Mangyayari lang po yung walang warning kung alam na po natin na yung isang area ay clustered na yung mga kaso at matagal nang nangyayari, baka ipatupad pa rin ang importanteng pagla-lockdown ng madali, ano? Importante masunod po yung proseso na magre-recommenda ng isang granular lockdown ay manggagaling sa local health office. May posibilidad po na magkakaroon ng prior notice, depende na po sa lokal na gobyerno, pero may mga panuntunan din po yan na pag ang isang area ay nasa granular lockdown, kung may palalabasin lang para mamili ng pangangailangan ng bahay bago ipatupad ang isang lockdown, isang tao lang po para sa sa bawat bahay.
Opo. Nabanggit po sa laging handa nung Sabado, doble ang vaccine bubble na isinusulong ng DTI at ni Secretary Joey Concepcion. Kasama po ba na-approve ito for 16 implementation?
Opo, meron lang po sa alert level 4 po, meron lang tayong 3 aktibidades na exempted o gagamitan po ng exempted sa indoor activity. Ito po yung indoor dining, ito po yung religious activities tsaka personal care. Pinapayagan po ng up to 10% capacity ng 3 aktibidades na ito ang pagpasok ng mga taong fully vaccinated. So ito po lang exception to the general rule sa alert level 4. All the rest po, hindi po pwede. At babanggitin ko po na dito rin sa 3 aktibidades na ito, pinapayagan po up to 30% capacity naman kung gagawin po ito sa labas.
Opo. Yusek, kunin ko na lang yung mensahe mo sa ating mga
At sa ating mga kababayan, inuulit po natin, nakapilot po tayo sa Kalakang, Maynila from September 16 to September 13 itong mga alert levels. At yung granular lockdowns, patuloy po natin itong gagawin sa buong bansa. Ang importante po dito, sumunod po tayo sa ating minimum public health standards. Paulit-ulit po, dahil again, ito po ang pinaka mabisang pamamaraan para hindi tayo mahawa at makapanghawa. At kung maging matagumpay po tayo nito, ibig sabihin po, nagiging totoo po ang ating hangarin na hindi po kumalat ang COVID-19 at mabawasan po ang ating mga kababayan na ma-infeksyon itong COVID-19 na ating dinaranas ngayon.
Opo, maraming salamat po sa inyong panahon, Yusek Epemaco Densing III ng D.
Salamat po.
Kaugnay pa rin po sa nalalapit na eleksyon at din ngayon ang mga maling impormasyon tungkol sa ilaman may babala si Senator Bongo tungkol dito. Narito po ang detalye.
Nagbabala si Senator Christopher Bongo sa publiko na maging mapagbantay sa mga nagkalat ng mga fake news laban sa kanya, lalo ngayong papalapit na ang halalan. Ayon sa Senador, may ilang grupo na nagpapakalat ng maling impormasyon para manira at magkawatak-watak ang mga Pilipino. Tiyak naman na niyang walang aasahang maganda mula sa kumakalaban sa administrasyon at sa kanya, kundi ang hatakin pababa at sirain ng imahe sa pamamagitan ng black propaganda. Tiwala naman sigo na matatalino ang mga Pilipino para mawari ang peke sa katotohanan at ang paninira sa propaganda. Hindi na anya siya magtataka kung may magpapakalat ng kasinungalingang laban sa kanya. Isa na anya dito ang pinakakalat na pinatatayong bahay sa isang exclusive village sa Ayala, Alabang at ang pagdamay sa kanyang pamilya sa mga issue. Muli namang ginit ng senador na hindi siya interesadong tumakbong pangulo sa susunod na taon, kaya nagsasayang lang ng oras ang mga nais siyang gibain. Ayon sa senador, desperado na ang mga kalaban nito sa politika kaya hindi nila alintana sino man ang masasagasaan sa mga akusasyong walang basihan. Sa kabila nito ay tuloy-tuloy lang anya siya sa pagtupad sa tungkulin sa bayan at sa kapwa mga Filipino.
Balikan naman po natin ang mga balitang nakakalap mula sa iba't ibang lalawigan sa bansa. Mula sa Cordillera Region, magbabalita si Ala Sunduan.
May 2 bagong grupo ng mga magsasaka na nabuo sa Tuba Benguet at karamihan sa mga membro ay mga kabataan. Una ay ang asosasyon na Samara na binubuo ng mga kabataan at Azul na karamihan din ay mga batang magsasaka ang membro ayon sa pangulo nito. Sa monitoring ng Tuba Municipal Agriculture Office sa mga barangay, dumarami ang mga kabataan na naiengganyo na pasukin ang pagsasaka na nagsimula lamang sa pagiging plantito at plantita.
Very important that these young farmers are already emerging para ma-sustain din natin yung food security natin.
Malaking tulong naman ang pagdami ng mga organisasyon ng mga magsasaka sa pagtaguyod sa bayan bilang agri-eco-cultural tourism site.
Yun ang kinabubuhay ng mga tao at saka with the help of the LGU, sana ma-promote itong agro-ecotourism namin ng Tuba.
Ang pagiging organisado ng mga magsasaka ang nakikitang daan upang mas mapabilis ang pagbabahagi ng tulong ng gobyerno sa kanila. Alas Sunduan para sa bayan.
Maraming salamat sa iyo, Ala Sunduan. Sa Visayas naman po, magtaas si John Arua.
Nagkapit-bisig ang mga kawani ng BJMP sa lungsod ng Cebu para tulungan ang mga guro sa pagbubukas ng klase. Namigay sila ng printing material sa Guadalupe Elementary School. Nagbayanihan rin sila sa paglilinis sa paaralan.
Kasi para po matulungan din po yung mga guro natin, especially po dito sa aming adopted school na Guadalupe Elementary School po.
Malaki naman ang pasasalamat ng mga guro sa suporta na ibinigay ng grupo.
We are very happy and even more than happy, Sir John, to have stakeholders to help us, especially in the very challenging printing of modules that we have been facing since last year.
Nakakapa ano po ng kalooban na nakatulong po tayo sa ating kapwa guro po.
Ang Guadalupe Elementary School ang may pinakamaraming enrollees sa elementarya ngayong school year sa buong Cebu City, kung saan nakapagtala ito ng nasa 9,000 ng mga mag-aaral. Umabot sa 1.9 million ng mga enrollees ang naitala ng DepEd 7 ngayong school year. Mula sa PTV Cebu, John Arua, para sa Bayan.
Maraming salamat sa iyo, John Arua ng PTV Cebu. At sa Davao Region, may report si Jay Lagang.
Sa panayam kay Mayor Sara Duterte sa Davao City Disaster Radio kahapon ay kinumpirma niyang karamihan sa mga nagpupositibo ngayon sa COVID-19 sa Davao City ay hindi pa nababakunahan. Sa 3,304 na nagka-COVID-19 noong September 5 hanggang September 11, 2021, 91.13% sa kanila ay unvaccinated at 8.86% naman dito ang vaccinated. Kinumpirma rin ng alkalde na karamihan sa mga vaccinated na COVID-19 positive cases ay nakatanggap ng Sinovac vaccine na siyang pinakamaraming brand ng bakuna na na-administer ngayon dito sa lungsod. Pero nilinaw ng alkalde na ang mga tinamaan ng COVID-19 na nabakunahan na ay mga mild o asymptomatic cases lamang. Patuloy din na hinimok ni Mayor Sara ang mga Dabawenyo, lalo na yung mga kabilang sa priority groups na kaagad na magpabakuna. Dahil kahit na nagpupositibo pa rin sa COVID-19 ang nabakunahan na, ay napipigilan naman ng vaccine na maging severe o critical ang isang COVID-19 positive patient, na malaking tulong din sa ngayon, lalo pat halos puno na ang lahat ng intensive care unit o ICU beds ng mga COVID-19 hospital sa lungsod.
Magpabakuna ba ko? Bisan there is the chance na mag-positive ko? Yes. Because ang bakuna makapatabang siya sa imuha nga dili ka mahimong severe or critical case.
Payo din ng alkalde sa lahat ng mga nabakunahan na ng first dose o maging ng second dose na huwag magpakampante at patuloy na sumunod sa health protocols upang hindi mahawaan at hindi maging dahilan ng transmission ng nakamamatay na virus. As of September 12, 2021, 634,981 na ang nakatanggap ng first dose at 629,787 naman ang naka-second dose na dito sa Davao City. Sa buong Davao Region ay umabot na sa 1,666,260 ang nakatanggap na ng first dose ng COVID-19 vaccine at nasa 751,366 na ang fully vaccinated. Mula dito sa Davao City, Jay Lagang, para sa Bayan.
Maraming salamat sa iyo, Jay Lagang ng PTV Davao. Maraming salamat din po sa ating mga partner agency para sa kanilang suporta sa ating programa at maging ang kapisanan ng mga broadcaster na Pilipinas o KBP. At dito na po nagtatapos ang isang oras nating tapatalita. Ako po si Yusek Graphic Naso ng PCOO. Magkita-kita po muli tayo bukas dito sa Public Briefing #LagingHanda.Ph.
Kaya natin to. Kaya natin to.